Thank you. Stuart McMillan, to be followed by Mike Rumbles.
Thank you, Presiding Officer. The Cabinet Secretary will be well aware of the particular circumstances facing Inverclyde with population decline, an older population which is growing, 15 care homes, and after 2 sets of NRS data being published, we now have the unenviable figure of 3 times the level of COVID-19 deaths than any other part of Scotland. What additional actions and resources will the Cabinet Secretary introduce to help reduce the level of deaths in my constituency with a focus on care homes, particularly regarding the residents and their staff?
Cabinet Secretary.
So, as I said previously, Directors of Public Health, that's NHS Directors of Public Health, have now been given the authority to intervene directly in care homes in their locality. That is to ensure that primary care is directly engaged with all those care homes, to provide NHS staff where the care home provider agrees to that, in order to ensure that the right clinical interventions are made in terms of helping care home staff who may want more in the way of training in terms of infection prevention and control, to check the levels of PPE and that all the guidance from the 13th of March onwards is being followed. Now, that is the case for all Directors of Public Health with all of our territorial health boards. They have all made contact with all 1,083 care homes in their area. They are paying particular attention to those care homes that have an active case and ensuring that the testing that I mentioned earlier is underway, if not completed. And they are in constant touch in those care homes. But they also need to pay attention to those care homes where there is not yet any active case, because we need to, if you like, shield them and make very sure that they have everything in place to prevent an active case in as much as that is possible. If there are additional measures that are required in Inverclyde or in any other area, then the Directors of Public Health have the authority to introduce those. And I am happy to make specific questions of the Director concerned in Mr McMillan's constituency and ask him through me to provide the additional information or the information to Mr McMillan about exactly what they are doing with the care homes in the Inverclyde area.